Good afternoon and welcome to the Talking Cafe from the Taunton team. My name's Carolyn. I'm a village agent with the Taunton team, and I'm delighted to be joined by Krista from Headway, Somerset.
Hello.
Welcome, Krista. It's lovely to see you. And you're going to let us know all about your wonderful service, Krista.
Yeah, no, absolutely. Just really good for as many people as possible to know about the service that we provide and that we're here to support anyone who has an acquired brain injury.
Yeah, wonderful. How long has the organisation been in existence, Krista?
2020, auspicious, not necessarily, was our 30th year. Obviously, we had lots of plans and celebrations for that, but other things overtook. So the charity was established 30 years ago, just over 30 years ago, by some parents of a woman with an acquired brain injury. And they realised that there was once the initial hospital support was over, there was very little in the community to support them and to support her, and they started Headway Somerset. Headway UK is a national charity. We are Headway Somerset, so we're affiliated to them, but we are a totally independent charity in our own right.
Oh, okay. So would you like to just explain to people who may not be aware of the term acquired brain injury as opposed to perhaps what could be from birth?
No, absolutely. An acquired brain injury is an injury caused to the brain since birth. So that could be a fall, a road traffic accident, or it could be an illness. It could be a stroke, or it could be some sort of aneurysm or meningitis. So it's something that's happened to your brain after you've been born. And that causes lots of different problems for some people, and things like concussion. For some people, it's a very short-term thing, which they will have for a day or so, and then they will be fine again. And for other people, it has very long-lasting effects.
Yeah, so lifelong for some people.
Absolutely,
and obviously for many people.
Absolutely, and for them and for their families, their carers, their friends, and people who are in contact with them. Employers, colleagues at work.
So what are the ways in which you are able to support from Headway?
We've got a variety of services. We have our rehabilitation centres across the county. So we've got one in Yeovil, which at the moment is partly in Yeovil and partly in West Camel, again, because of the COVID restrictions. One in Taunton, one in Bridgewater, and one in Henton, which is just outside Wells. And those centres are there to provide rehabilitation support to people on an individual basis. So whatever someone's individual needs may be, we do our absolute best to cater to them for that. A lot of people have said to us, those centres are such a huge support because they meet people who really understand the condition. People suffer from huge fatigue, from short-term memory loss, and it's great for them to be able to be amongst peers who really get it. So those centres provide a huge amount of support for people.
And are they on weekly or more or daily?
We have all the centres should be open twice a week. It's a little bit different at the moment because we are on our way to going back to full capacity and back to normal. So across the county, they're on different days in different venues. All that information is on our website if you want to have a look and see what day they're on.
Yeah. And that's a full day. Is that a full day?
10:30 till 2:30, which for a lot of people is as much as they can do because it does make people very, very tired. And we work with people on budgeting skills. We work with people on sorting out their day-to-day living skills, improving their self-esteem and confidence, and learning about their brain injury and the way they can move forward with it. So it's very much tailored on an individual basis.
Yeah. And do they have kind of the opportunity, presumably as well, for people at those sessions to be able to socialise and maybe have a bit of fun and
absolutely. The biggest noise you'll hear when you go into the centres is people laughing because they are there to really help you get back on your feet again and to give you those skills that you need to progress and engage more in your community.
Yeah. Do you have some visits to different places of interest as well that people can take part in?
We had activity centres where activity sessions where people were going out and about. We'd go to the sea one day, so we'd have our social club, which is where people could join in and do that. That hasn't happened for a while, obviously, since COVID. And at the moment, we're really reevaluating and working with our service users to work out what they want that service to look like. We did trips to Longleat, we did trips to the sea, trips to do fudge making, all sorts of different things, boat trips. But it really is working with the people that we're working with to find out what they want and what they need.
Yeah, absolutely, because it's a big part of it for everybody, as it has been through the last year or so, is the social isolation, and for people who have particular situations ongoing, that's always a potential issue, isn't it? That is really important to be able to address and support people with.
Yeah, absolutely. And that's something that our Making Headway project, which is a lottery funded project that we have, is doing a huge amount of work with. That project works with trained buddies. So we have volunteer buddies who go through a rigorous training process, and we've turned that all, and that's all done online now. And then those buddies are matched with an individual who they are then their specific buddy. And that really is about getting people out and about. And that can be anything from, again, based on what that individual wants, from what I really want to do is join a local gym. What I really want to do is go to an evening class. What I really want to do is go to the garden centre. Actually, I'd really like to get into the post office at the end of my street to buy a stamp. And that's what those buddies will work with that person on an individual basis. And as time moves on with that project, again, when the restrictions are lifted, we're going to have group sessions. So the buddies, so if there's a couple of people in a particular location, they'll be able to get together with their buddies and go and do something that they're both really interested in, whether that's going for a walk or going and doing some sort of activity or going and having a cup of tea.
Yeah, just day-to-day things that
day-to-day things and getting back out into their communities, because we're very lucky in Somerset. There's loads that goes on. And as a village agent, you'll know that better than most people. Community is such a huge hub. And again, when the world is turning properly again, those hubs are there to be accessed.
Yeah, absolutely. And we can they are starting to slowly but surely restart on it, thank goodness. And so is that, am I right in thinking, Krista, that firstly, did you say the buddy system, did you say that was volunteers, or are they paid?
Yeah, no, they are. We have a volunteer coordinator who is paid, and then she has a team of recruited volunteers who are all incredibly well trained and have lots of different support systems in place for them should they need it, and they are matched on a one-to-one basis with an individual.
Oh, that's great. And so then you're going to keep perhaps a combination of the online as well as the literal kind of getting out into the community. Is that still under consultation?
Again, the project started March 2020. You really couldn't write about it. So it has, all the training has happened from day one online. And actually what that does is it brings together people geographically as well as from different backgrounds to do their training. And I think it's probably, I doubt very much we will, I'm sure, the buddies will meet together. We will have sessions for them. We'll get them together so they can meet and support each other. But that training will remain online because it means anyone can access it. You're not driving halfway across Somerset in the dark and the sleet. Yeah. All you need to do is pop your laptop on to engage with it.
So you mean that you started it completely coincidentally with the lockdown? That's just, I see what you mean.
Trish started the day lockdown started.
Gosh, that's
so it's a project born of lockdown, which meant that all the amazing plans. I don't know whether I'm sure you have been involved in lottery funding applications, but everything in that lottery funding application had to change to accommodate 2020 and COVID, and also to accommodate the different sorts of volunteers. So it's been a huge learning curve. We've been incredibly reactive to it, and it's meant that I think we've probably created a much better form of training because of the ease of access. You know what it's like if you've ever done anything like that, where you need to be in, oh goodness me, Langport Village Hall at 7 o'clock at night, and it's 6:30, and you've just got in, and all you want to do is put your slippers on and watch the telly. Well, actually, you can still put your slippers on. You haven't got to drive halfway across the county. You can engage with people, and you can do it all from your sitting room.
Yeah, that's changed for so many organisations and individuals for good, hasn't it?
Absolutely. And the other really nice thing is we have a lot of young volunteers who are students who, again, signed up initially because they were at home. And a lot of them are now back at university, and they are still volunteering with us because they're doing their buddying online.
Yeah.
So they're doing phone calls with people, they're having Zoom calls with people to support them. Yeah. And they're finding lots of creative and different ways of working with people too. And it means we're keeping our lovely students, which is fantastic.
Yeah, because that wouldn't have been possible, obviously, would it, before?
No, wouldn't have, no.
Format.
No, absolutely.
So do you have an idea of the numbers that use your service at the moment, Krista? Just I don't mean to pin you down at all, but with the question I just suddenly thought of it, just to give an idea of the volume.
It's really tricky to say because of the different levels to our service and the way our services change. But we probably support about 60 people at any one time. That will be increasing now because of making Headway and the buddying project. Across our centres, we do community outreach as well. So we actually go out and work with individuals in their own home, again, sorting out their day-to-day life and helping them to engage and getting them going again for people who aren't necessarily wanting to come into a centre, or a centre isn't the right place for them. So that's something that happens on a one-to-one basis. Another service we have is our hospital liaison service, which is we have 2 workers who work out of Musgrove Park and Yeovil District Hospital, as well as the Somerset Neurological Rehab Centre, which is at Dean Barton. And they are probably the first people that anyone with an ABI and their families will see. Someone is admitted to hospital. If Jane or Wendy are about at the moment, they will talk to their families and they will support them through that process. When someone has had a life-changing injury, actually the last thing they want to do is talk to us, because they're very busy being looked after by the magical medical things that need to happen to them. What their family and their carers and their friends who are stood there not knowing quite what's going on need is Wendy and Jane to be there, give them information, say, you might not want this now, but actually this is my number, this is where I am. Do contact me when you need to.
Yeah, that's very important, isn't it?
They then work with those people during their rehabilitation process while they're still in hospital, and signpost them on again afterwards to different services, whether they're ours, whether they're something else, whatever the most appropriate thing for them is. And then we do an ongoing relative and carers group, again, to support people, because the person who, slight scenario, the person who walked out the door to go to work and had a car accident is not necessarily the same person who walks back in your door 18 months later after spending 18 months in hospital and having had a long spell of rehabilitation in one of the centres. Yeah. So it's very hard for families.
Yeah, absolutely, because it affects all of that person's family and friends.
Because sometimes it's a different person.
Yeah, absolutely. Yeah, and it's and quite often it can be and it is a life-changing event, isn't it? As you said, it's
absolutely. I mean, we've worked with people who have had to totally relearn to do everything. They've had to relearn to walk, to talk, a personal care, to engage with people. I can remember chatting to a young man in one of our centres who said to me, and it's stuck with me ever since, that I stand in the bathroom and I have my toothbrush in one hand and my toothpaste in the other, and I know they go together, and I know I have to do something with them, but sometimes I'm just not entirely sure what that something is.
Yeah, that's really powerful, isn't
and for that young man's mother and the rest of his family, that's really hard.
Yeah. And it's coming to terms with that difference, isn't it, for the person concerned, and as you said, the families
and people who are around them. Absolutely, the people that love them, and
and also then it's having that positive impact and influence from organisations such as yourselves, that yes, it's different, but there can still be so much that's good once you've worked a way around things.
Absolutely, and it's there's a lot of acceptance that needed from everybody. It's a very big thing, as you can imagine.
And to be able to then meet up and realize that it's not, you're not on your own, and that there is so much there that can help and make things, make your life good, and there's the best that it you would want it to be, and then that can change somebody's. It's about, like you say, it's about acceptance and coming to terms with the differences and working a way around so that you can do as much as is possible for you to be able to enjoy your life, obviously, and have a great quality of life.
Absolutely. And there are, as with anything, there are ups and downs. There will be days that are really hard and there will be days that are great. And I think something that COVID has taught us all is that some people are a lot more resilient than sometimes you give them credit for, because I think if people had said, actually, you're going to be in your house for the next 6 months, and we'll let you go to Tesco's, we'll let you go to Boots, actually, that's it, I think people would have been absolutely horrified.
We were. Yeah, we definitely were.
We've got through it. And people have learned new skills. Our service users who had you said to us a year ago, they're going to be logging in on a Zoom call, and they're going to be getting involved in all sorts of things. We might have doubted that was something that they could do, but the IT skills that people have learned, I include myself in that. I would never have thought I would be doing any sort of a Zoom call or anything like that. I certainly would have thought I'd be doing a Zoom quiz, to entertain myself of an evening. I would have balked at the thought. Yeah, but I think it shows how adaptable we are. Another aspect of something that is something that's sort of going to be coming online soon, something we really want to raise awareness of, is concussion, especially after sports injuries, so that there's a big sit it out campaign. So for anyone who's playing rugby or football or any of those contact sports who's had a bang to the head, very often they'll come off the pitch and will go, no, I'm fine, I'm going straight back on again. But something that we really want to highlight is actually people do need to sit it out for 15 minutes and see how they're feeling. Because instantly going back on again can be the worst.
That is really, I don't know if you were involved, if Headway were involved in that change, Krista, but it certainly has, obviously, with health and safety and the recognition of brain injury and potential brain injury, that you can see with the sporting events, can't you, now, that they are much more rigorous than they were previously.
Yeah, absolutely. And again, it's the same with cycle helmets. Please wear one. Hard hats for construction workers. Every time I go past any scaffolding now and there's somebody up there without a hard hat, and I want to pull my car over and talk them down, ask them for help.
It's really shocking, isn't it? Because it is a health and safety requirement, and it doesn't always happen still, does it?
It doesn't always happen. I mean, we've worked with people in the construction industry whose lives have changed because they banged their heads, or whose lives have changed because they banged their heads, but actually they're still with us because they had a hard hat on. And that's the same with cyclists. Again, so important to protect your head. And it seems so straightforward. And I think everyone thinks, oh gosh, that won't happen to me, but it does happen.
So the City Type campaign, Krista, did you say that you are involved in it now?
We're absolutely involved in it, and it's something that's ongoing, but it's something that we'd like to really roll out and build awareness of to schools and local sports clubs. And again, hopefully coming back out when we're all out and about again a lot more. It's something that we're going to be working on.
Yeah, it is really important. And there's so many other sports that, whichever sport, horse riding is another one, isn't it?
Again, we have someone who we work with who was a jockey, and she had a fall, and she now her life has changed. So it is. We work with lots of fabulous, fascinating, amazing people whose lives have completely changed in a sort of a snapshot of time. So wear a seatbelt, put your cycle helmet on, wear a hard hat. If you've had a bang to the head, do sit down for 10 minutes, 15 minutes before you do anything else. And I think if one message we can get across today is for people to be incredibly aware and look after their heads, that's one I'd really like to get out.
Absolutely. I'll put some more information on the chat about contact details as well, Krista, so that people can view it afterwards as well. So for instance, if you were you mentioned about the liaison workers at the hospital at Musgrove and Dean Barton, I'm sure that if somebody was suspected or they diagnosed a brain injury, the hospital staff would
absolutely. They're very aware. They're very aware. I mean, obviously, it's 2 members of staff who cover 3 sites.
Did you say Yeovil as well?
Yeah, Yeovil. Yes, absolutely. Because we cover the county. That's something that we're very passionate about is Somerset, because that's the county that we cover. Yes, Yeovil District Hospital, Musgrove, and the Somerset Neurological Centre, which is out at Dean Barton.
Yeah. Okay. So we've got the website address up there already. I'll put the contact details and your phone number if somebody wasn't online, the number that they would ring, and I'll jot that on there as well on the chat. What would be the main number that people could make contact?
That's just gone right out of my head. But what
sorry for that. I'm sorry to put you on the spot.
No, I can. We'll get that in approximately 2 seconds. If you bear with me. It's,
of course.
Of course. It's not that at all. Gosh, this is terrible.
No, not at all. No, apologies. I didn't. Is it? Yeah,
I could have told you if you hadn't asked me. It's 01823 618519.
618519.
That's right, and that's our main office number. So that's really our admin number. I guess that kind of very neatly segues us into our latest service, which is Talking Headway.
Yes, I was going to ask you about that.
What we have is a phone line. It's been amazingly generously funded by a family member of someone who we work with, and it's very limited opening hours at the moment, but we're hoping to expand that. So it's open Tuesday, Wednesday, and Thursday between 1 and 3, and it's an information line. So if anybody wants any information about our services, if anyone wants to have a chat with her, that number is 01823 215014. And something else.
5014.
Yes, so it's 215014. And something else we're doing from that line is actually after we've had a chat to someone, if what we think would help them would be a volunteer buddy, then we can refer them on to our volunteer buddying service.
Yeah. So basically they can when they ring either of those numbers, they can get information on what is available.
Yeah, absolutely. But if it's a general inquiry and someone wants to have a chat about what they do, the best time is to ring our Talking Headway line, which, like I said, is Tuesday, Wednesday, and Thursday afternoons, 1 till 3.
I'm just going to pop that on there for a second as well. Tuesday, Wednesday, Thursday, 1 till 3.
1 till 3. And again, all this information is on our website and on our social media accounts.
Yeah, great. Do you have a couple more examples of anonymous case case studies, if you like, of ways that you've been able to support somebody with and help them with the things that they'd like to do?
I mean, we have people who have really got back out. We've had people in our centres who, with the support of staff and volunteers, have learned to be so much more independent, who've got back out there again and who are now doing their own shopping and joining different clubs and societies. We have people who have started driving again. I mean, and that's down to their sheer tenacity and hard work, because it is hard work, because I think the fatigue and everything else that people can suffer with is just enormous. So it's such a wide gambit of people and situations and life stories. It's vast.
I've just seen a message from Sarah. Hello, Sarah. To ask if you have any patients in your groups with, I have to admit, I've not heard of this term, putridity tumor operation patients.
I'm not clinical. I will absolutely hold my hands up to that. I mean, if Sarah wants to send me an email afterwards, I can absolutely look into that for you. Or if she wants to pop an email address up into the chat, I can't see that, but I know you can, Carolyn, and I will.
Can you not see it, Krista? Yeah, of course I will. Sarah, if you'd like to leave your contact details, we can certainly.
I can certainly find out and get the right person to get back to you. I'm the fundraising and comms manager, so the clinical stuff isn't my speciality at all, and I wouldn't want to make it up or pretend. So I.
No.
I will absolutely pass that on to the right person and get someone to get back to you, Sarah.
Yeah, that would be great, Sarah, if that's okay. And yeah, that would just help. Yeah, maybe somebody that Sarah knows. Don't worry, Sarah, so is mine. Sarah's just said her spelling's rubbish, but
gosh. But I'm hopeful that this isn't a spelling competition, especially when you're properly at the bottom of that.
No problem at all, Sarah. If you want to give us some more information you can contact us afterwards. If you want, rather than putting your contact details online, that's no problem at all.
Or alternatively, if like I said, Tuesday, Wednesday, and Thursday afternoons, 1 till 3. If you want to ring Talking Headway, whoever that is might not have that answer for you, but they'll certainly be able to spend some time finding out and having a proper chat with you.
Yeah, that sounds great. Thank you for that. And you're also, I'm just having a look back at information you sent me earlier, Krista. You're on Facebook and Twitter and Instagram, aren't you?
We are, yes. And they're quite. I mean, Instagram and Facebook are obviously quite fun places too. And this week we are celebrating on their Volunteers Week. So we're celebrating all our amazing volunteers and saying a huge thank you, because we have volunteers in our centres. We have a volunteer who works with me, doing sort of background research into fundraising and companies and people who we can chat to spread the word more. And we also have volunteers, obviously, with Making Headway, with the Making Headway Buddies.
That's great. Yeah, I'm just sending a message to Sarah to say, please feel free to get in touch afterwards.
Yeah, no, apologies for not knowing the answer to that, but I can absolutely find out.
Yeah, no, that would be great. So when you mentioned about the rehab centres, are those the ones that are based out in the different areas that you?
Yeah, absolutely. They're the ones. So people will come in. They will either make their own way there, or they will come in through community transport. Everyone there has an individual assessment and an individual plan. So it is very much not a one-size-fits-all service that we're providing. It's about working with individuals on what it is they want to move forward on, and whether that's about budgeting, whether that's about getting out and about more, whether that's about learning a new skill, or trying to recapture an existing one, then we're absolutely there to work with that individual to do that.
Yeah, that's it's really great to know that service is out there. Sarah's just sent another message to say she's been meaning to phone you and find out for a while, so she's going to do that.
Fantastic, yeah. And talking Headway, that if that time in those afternoons works for you, Sarah, then absolutely that's a great time to ring because we have people who are dedicated with a nice chunk of time to really sit and listen and have a chat.
Yeah, that sounds ideal, doesn't it? And if somebody wasn't able to make those particular times, if they rang the main,
if they ring the main number, or they send an email to info@headwaysomerset.org.uk, and again I'm sure Karen will pop those details up for people, then we will get back to you as soon as we possibly can. That might be a good way for people who might struggle between those slots, so that's great. Yeah, no, absolutely. I mean, we're hoping to expand it, but obviously we're funding for everything, so we're
of course, of course. Well, it's a really wonderful service, Krista, and thanks for coming along and explaining it to us. It's great to know that those centres are out there across the county as and when they're opening up again. You don't have, I don't want to pin you down again, but you don't have any idea of dates yet when they may be.
Yeah, they're all open. All our centres are open. Oh, absolutely.
Oh, when did they open again? Sorry, I missed that.
Centres opened. We were open. They're not open fully because we have to have restricted numbers at the moment because of social distancing and because of the other restrictions. And also some people aren't confident enough to come out again at the moment. So people are slightly reticent about re-engaging, but I'm sure people will be back very soon when some of those more restrictions are lifted. No, absolutely, the centres are open. Every one of our centres is open.
Right, I'm just putting that on there to make it absolutely clear. So did they
we've done a bit of opening and closing. We closed initially, then we opened for a very short period of time, then we shut down again. And then we opened again when the initial lot of restrictions started to lift a little bit this time around. So I think it was that end of February, beginning of March this year.
That must have been an absolute lifeline for
absolutely. And people were, even though people were socially distanced, and if they were moving around, they needed to put a mask on. Whereas before, there was a lot of social chit chat over when people went and made a cup of tea and all that sort of thing. We can't do that at the moment, so people have to come, with their lunch and with drinks and everything else, so we can fulfil all the regulations of not just the government but also the places where we're working, because some of the halls and things have very specific requirements that we want to work with people and worked for too. But people were so pleased to be back, to be re-engaging and to be having fun again. So that was really nice, as well as to start reworking again on their rehabilitation programs.
Absolutely. And just thinking about food, as it's kind of before all the restrictions, was a lunch provided just for so people
in our Bridgewater Centre, because we're in Victoria Park Community Centre, and they have a cafe there, so people could go and order a lunch, and then we'd have a big table in the dining room, and everyone would eat together, or they could bring a packed lunch. We don't cook. No, absolutely no. We don't have the facilities to do that. And actually, I think historically that has happened. But what happens then is the entire day is taken up with cooking and eating lunch, which is not a bad thing. Probably not really the aims of what we're doing.
The best use of your time.
No, absolutely not the best use of the people that come to all the funding, because people are funded to come. People who are funded to come to us have very specific aims, and we need to fulfill them and work with them, so they
focus on those.
Absolutely.
But nevertheless, the centres where there is some kind of catering facility is perfect, isn't it? Because then people still have that opportunity for that social kind of occasion, which is nice, isn't it?
No, actually, since people have all started bringing their packed lunches, actually, it's meant we've had we've had more time, and it's just as social an activity because people are still, everyone stops together, everyone eats together, albeit socially distanced at the moment.
Yeah, it saves a huge amount of time, doesn't it? And obviously you can bring exactly what you would want to eat, can't you?
Absolutely, and any sort of dietary requirements, whatever, you know exactly what's in your sandwiches, don't you?
Yeah, definitely. It all sounds fantastic, Krista. It really does, and thank goodness you're here for everybody that needs you, and thanks also for coming along today. It's been really informative and interesting, and really great to know that that's available for people who would want it and need it. And so thanks once again, and the links there to get in touch are there. Good luck, Sarah, with them.
Sure. Look forward to talking to you soon, Sarah.
Yeah, that would be. And thanks again, Krista, and we'll see you again soon, hopefully.
Lovely. Thank you.
Thank you.
Bye-bye.
Thanks everyone. Bye-bye.